Formation of dentition. Nomenclature. Formula for mammalian teeth. Welcome to the first video in our series on dental anatomy. In this series, we will delve into the world of dental anatomy, covering everything from the basics to advanced topics. In this video, we're starting at the very foundation, basic nomenclature, the formation of dentition, and the formula for mammalian teeth. So let's jump right in. Our first step in grasping dental anatomy is to become familiar with the terminology, which is the set of names used to describe and categorize the elements in this subject. So let's begin with the basic nomenclature. We possess two distinct jaws, the upper jaw, scientifically known as the maxilla, and the lower jaw, referred to as the mandible. These two components house and support our teeth. These represent the arch trait. Any tooth can belong to the maxillary arch or mandibular arch. Within the maxilla and mandible, we find two distinct sets of teeth over the years. The primary dentition, often called deciduous teeth, and the permanent dentition, also known as succedaneous teeth. This represents the set trait of the tooth. That is, any tooth can belong to the permanent or the deciduous set. We also have the side trait. That is, the tooth can be on the right side or left side of the arch. If we ask a layman to classify teeth, they will say incisors, canines, premolars, and molars. This is the class trait. That is, there are 4 classes of teeth. Some of the classes can have more subtypes. For example, incisors have central and lateral incisors. Premolars have first and second premolars, and molars have first, second, and third molars. These are the types of the class, thus called the type trait. Remember, canine is the lone ranger. It doesn't have a type trait. So now we know the 5 traits of a tooth: set trait, arch trait, side trait, class trait, and type trait. To identify any tooth, we need to represent these 5 elements of nomenclature. For example, in right permanent maxillary central incisor represents the right side, permanent set, maxillary arch, central type, incisor class of the human tooth. Some variations are: deciduous teeth do not have the premolar class. Canines don't have the type trait. Deciduous molars have 2 molar types, but permanent molars have 3 types. Let's now move on to the concept of the formula for mammalian teeth. What is the formula, and why do you think we need a formula? This is to distinguish the dental patterns of humans from those of other species. We use specific formulae that denote the names and numbers of all mammalian teeth. Each tooth is represented by the first letter of its name, like I for incisor, C for canine, P for premolar, and M for molar. Following each letter, there's a horizontal line, and the quantity of each tooth type is indicated above the line for the maxilla and below the line for the mandible. So, the formula for deciduous dentition looks like this. It should be read as incisors, 2 maxillary and 2 mandibular, canines, 1 maxillary and 1 mandibular, molars, 2 maxillary, and 2 mandibular, or 10 altogether on one side, right or left. The formula for the permanent dentition would be like this. Premolars have now been added to the formula, 2 maxillary and 2 mandibular. And a third molar has been added, 1 maxillary and 1 mandibular. 16 altogether on one side, left or right. So remember, these formulae only encompass one side, as the number of teeth in each jaw is identical for humans. Let's now explore the timing and formation of dentition. In a human's lifetime, 2 sets of teeth are present. The initial set, known as primary or deciduous dentition, starts forming around 14 weeks before birth or prenatally, and is typically fully developed by the age of 3. The first deciduous teeth, usually the mandibular central incisors, appear in the mouth at around 6 months of age, with the last ones being the second deciduous molars, emerging at approximately 28 to 32 months. The deciduous dentition of 20 teeth in total. Within this set, there are 4 central incisors, 4 lateral incisors, 4 canines, and 8 molars. The deciduous dentition stays intact until a child reaches around 6 years of age, unless they are lost due to caries or trauma. During the phase between 6 and 7 years of age, the deciduous teeth start to shed, creating space for the permanent teeth to erupt. The appearance of permanent teeth marks the beginning of the transition or mixed dentition phase, where both deciduous and permanent teeth coexist, typically from ages 6 to 12. This phase concludes when all the primary teeth have naturally fallen out. It's at this juncture that the permanent dentition phase commences. In contrast to the deciduous dentition, the permanent dentition comprises 32 teeth, which includes the addition of the first and second premolars and the third molars. The shedding of deciduous canines and molars marks the emergence of permanent canines and premolars. The permanent dentition is completed at approximately 14 to 15 years of age, after the emergence of the second permanent molars, except for the third molars, which are completed at 18 to 25 years of age. Let's now summarize the 4 terms. The term primary refers to the first set of teeth, and deciduous name is given, referring to the deciduous trees that shed their leaves. Similarly, the primary teeth shed to give space to the next in line, or succedaneous teeth. The term permanent refers to a set of teeth meant to last a lifetime, but is in your hands to maintain and take care of them. Let's pause with a few questions. Try to answer them. Why are deciduous teeth also referred to as milk teeth? This is because they resemble the color of the milk. They are whiter than the permanent teeth. The refractive index of the deciduous teeth is close to that of the milk. This is why they are referred to as milk teeth. The first deciduous and permanent teeth to erupt in the oral cavity are A. Deciduous mandibular central incisors, permanent mandibular central incisors. B. Deciduous maxillary central incisors, permanent mandibular central incisors. C. Deciduous maxillary central incisors, permanent maxillary central incisors. D. Deciduous mandibular central incisors, permanent maxillary and mandibular molars. The correct answer is option D. The first teeth to erupt are the deciduous mandibular central incisors, typically erupt at 5 to 8 months, followed by the maxillary central incisors. By 19 months, a child has about 12 primary teeth. By 23 months, 16. And by 27 months, all deciduous teeth should have erupted. The first permanent teeth to erupt are the maxillary and mandibular first molars, which emerge around 6 years, coinciding with or preceding the shedding of deciduous mandibular central incisors. Permanent mandibular incisors arrive between 6 and 7 years, followed by permanent maxillary incisors between 7 and 9 years. And that brings us to the conclusion of this video. I trust this information has provided you with a solid foundation in dental anatomy. Make sure to stay tuned for our next video, where we will explore the diverse tooth numbering systems.